Around the world, cases and deaths are continuing to increase at worrying rates. Globally, the number of new cases per week has nearly doubled over the past 2 months. This is approaching the highest rate of infection that we have seen so far during the pandemic. Some countries that had previously avoided widespread transmission are now seeing steep increases in infections.
This virus variant, it's a variant of interest, the B.1.617 lineage. This was first detected and reported by India, having 2 mutations, the E484Q and the L452R. Those are specific mutations within the genome. This was reported by scientists out of India. They actually presented to us at our Virus Evolution Working Group on Monday, giving us some information about the studies that are underway and working in collaboration across the country, but also with scientists around the world. It was first seen in 2 states at the end of 2020, and there is an increasing proportion of cases of this B617 that have increased since the end of last year. As you know, these virus variants, the virus mutates, the virus changes over time. This is one variant of interest that we are following. Having 2 of these mutations, which have been seen in other variants around the world, are concerning because there's a similarity in these mutations that confer increased transmissibility, for example, and some of these mutations also result in reduced neutralization, which may have an impact on our countermeasures, including the vaccines. What we are doing is working with India and working with countries around the world to make sure that we increase the proportion of sequencing that is happening around the world, but making sure that this is intelligent sequencing so that we can detect where these variants of interest and these variants of concern are, but also linking with the sequences epidemiologic information, clinical information, so that they can be studied properly. Variants with certain mutations do mean that it can spread more easily, which means if it spreads more easily, you will have more cases, and if you have more cases, it will put more burden on your health system. And so this is one of the ones that we are tracking. It is one of the ones that's on our radar, and in doing so, it means it's on the radar of people around the world. But we have a system in place, and I think what is important is that WHO with partners is bringing together member states, researchers, different networks around the world to make sure that we have a robust monitoring and assessment framework. So it's not just important to say that there's a variant of interest that has been detected, it's really important that that assessment is robust. So we understand what each variant of interest and variant of concern means for transmission, for severity, and for impacts on diagnostics, therapeutics, and vaccines. That system is being strengthened around the world because right now, the variants that have been detected the vaccines still work against these variants of concern, against severe disease and death, and that's really, really important. But we want to have a system in place should there need to be a change in some of our countermeasures going forward. And so this is one of the ones that we are looking at. This is one of the ones that we are tracking. Indeed, it has been reported in other countries, across Asia, across North America, but it is something we need better sequencing to better determine where it is circulating. So this is one of the ones that is on our radar, in addition to the B.1.117, the variant that was first identified in the United Kingdom, the B.1.351, which is the variant that was first detected in South Africa, and the P.1 variant that was first detected in Japan, but is circulating in Brazil and in a number of other countries.